everybody, Jean Link here. So I was watching a program on CBS that was going over the steps that dentists are taking to welcome patients back to their practices safely. And I was interested in it because it is meant for public consumption. So these are my comments. I actually thought it was quite good. It went over the CDC guidelines, which are screening your patients, taking their temperature, providing masks and hand sanitizers, using preoperative rinses, practicing social distancing, so some patients will be asked to wait in their car, and obviously PPE for the healthcare professionals. I think those are very, very sound guidelines, and we implement them all. So you may also be aware that about a day and a half a month, we have a nonprofit that treats patients with quadriplegia and traumatic brain injuries. So those patients are at very, very high risk, not of transmitting the virus, but what I mean by that is if they got the virus, it would be incredibly, incredibly dangerous. Some of them are on ventilators, and some of them have trachs, and they're not moving. They're not using their musculoskeletal system to kind of aerate their body as well. So that would be very, very dangerous. So we have implemented several other steps. We have UV lights in our air ducts. We have air sanitizers in the rooms, and we have intraoral vacuums, and then we have PPE that is more sophisticated than just the paper mask with the shield. Now, that is very helpful. PPE protects the healthcare provider, but it also protects the other patients. So if we have something that isolates everything on our body and we can take it off and sterilize it or throw it out, we can't get something and give it to somebody else. So I want to just show you real quick this capper. This has a seal. So when I put that on, there is nothing that I could get and share. So this is something that would be appropriate, like even if there was an Ebola outbreak. Now we take a lot of additional precautions that are not really considered necessary or reasonable for the general public, but since we have an adult patient population and we have some patients who have serious spinal cord and brain injuries, this is sort of up level in terms of infection control. So if you know anybody, say, who's pregnant or something, this is an incredibly safe environment. We've gone above and beyond, and we feel like for our particular practice, that has been a very wise choice. So hope that helps, and stay safe, everybody. Let's just get this over with. How about it?